Understand.
Suppose that you go to your doctor's office and complain of fatigue, guilt, worthlessness, irritability, insomnia, decreased appetite, loss of interest in regular life activities, persistent sadness, anxiety, and thoughts of suicide. You would probably leave the doctor's office with a diagnosis of depression and perhaps a prescription of Zoloft, Prozac, or another antidepressant drug. But is this always the right diagnosis for such symptoms? The answer is no. The same symptoms belong to a variety of other conditions that require treatments other than antidepressants and psychotherapy. They may certainly look and feel like clinical depression to the outsider, but they require a different way of treatment. Here are 10 conditions that might show the same symptoms as clinical depression that I'd like to explain to you. The first one is vitamin D deficiency. A good doctor will order a blood test to see if a patient is low on vitamin D before sending him off with a prescription for Prozac, because so many of us are lacking adequate amounts of the crucial vitamin D. Studies are increasingly showing that most people are vitamin D deficient, and that there is a close association between vitamin D levels and depression symptoms. The best source of vitamin D is early morning sun. If you have no high risk for developing skin cancer, do expose large areas of your skin without applying sunscreen for around 15 to 30 minutes. And if you can't be in the sun, supplements are available at the local drugstore. The second condition is hypothyroidism. Hypothyroidism is also easily mistaken for clinical depression. You feel tired and exhausted, worthless, irritable, and incapable of making a decision. Getting through each day without naps is a major accomplishment. Hypothyroidism, an underactive thyroid, is one of the most undiagnosed and misdiagnosed health problems in the world. A note to my medical colleagues: of course, TSH testing is not enough to diagnose thyroid malfunction. More tests are needed. The third condition is low blood sugar. People who experience fluctuations in blood sugar levels on a daily basis are usually insulin resistant. Insulin resistance has been recently linked with depression. But the good news is that simple diet modifications, like eating low-carb and high-protein foods every few hours, will help alleviate the symptoms. The fourth case is dehydration. Our thirst sensation doesn't really appear until we are 1 or 2% dehydrated. But then dehydration is already setting in and starting to impact how our mind and body perform. Food intolerance is also a factor that can affect your mood. Certain foods can trigger inflammation in your body, just like toxins from the environment would. Our bodies react differently during those inflammatory responses. So while some people would sneeze or break out in hives, others get sad and anxious. Keep a food journal and try to figure out whether you feel bad after eating certain food, especially red meat and dairy products, and eliminate them from your diet to regain your mood and healthy feeling about life. There's also caffeine withdrawal. That anxiety and depression you feel hours after having coffee is probably because your body is going through withdrawal. And for those who are chemically sensitive to all amphetamine-like substances that raise dopamine levels, that withdrawal translates to tears, shaking, and panic attacks. Certain medications prescribed for various medical conditions do cause such feelings, such as sadness, despair, and discouragement. And those feelings that are often associated with depression can be mistaken for depression. Medications that cause depression appear to alter brain chemicals in some way, and even though the drugs may be necessary to treat conditions that you might be suffering from, the side effect is hardly acceptable. As an example, Accutane, which is prescribed for treatment of acne, has been found to also sometimes cause depression. So have oral contraceptives high blood pressure drugs, and even statins that treat high cholesterol. If you think that your medication is causing you to get depressed, talk to your doctor about changing it. Iron deficiency is another case. If you have any type of iron deficiency, one psychological symptom could be signs of depression. While an iron deficiency may not be the sole cause of depression, it can cause symptoms similar to depression, such as lack of appetite, irritability, extreme fatigue, headaches, and mood swings. Also, anxiety is an example of psychological issues that can stem from having low iron levels. Lack of sleep is yet another factor that can affect your mood and make you feel depressed. Normal sleep is a restorative state. When sleep is disturbed or inadequate, it can lead to increased tension, vigilance, and irritability. Poor sleep can lead to fatigue. And with fatigue, you exercise less, and that leads to decline in your fitness level. Eventually, you find yourself in a vicious cycle of inactivity and disturbed sleep, which causes both physical and mood-related symptoms. There's also the heavy metal poisoning. Lead, cadmium from smoking, and arsenic can disturb your dopamine. This neurotransmitter gives the brain energy, motivation, and the capacity for pleasure. When it becomes deficient, you can get a low-energy, demotivated depression. Aluminium pots and pans slowly dissolve metal into your food, so you should change them to either high-quality stainless steel or glass. Reverse this build-up and actively eliminate this type of toxins by using supplements under the supervision of your doctor. I wish you the best of health. This video contains general information about medical conditions. The content might not be suitable for everyone and should not be treated as such. Always consult your doctor before using medications. The medical information is provided without any warranties or legal obligations to those who might apply them.